Thank you, Satish, and welcoming all of you to the session on role of public relations and media in pharmaceutical industry. I'm Swati, your host for today, and we have with us speakers on this topic. One of our very own Pawan and Aman from SPAG Fin Partners, who both of them have the expertise to speak on the topic, and we'll look forward to interactions from your side also. We look forward to questions, we look forward to discussions, not debates. So please hold yourself, because it is a topic on media and PR, and the moods may want to go into debate format. When we hear media, we generally a picture of TV debates come in, and we all start thinking, okay, now today we have a very entertaining session. Not that way. We have this session planned for you, and we are expecting good questions, good discussions from you. Starting with the introduction of the speakers. Well, we have today Pawan, as many of us know, Pawan Kulkarni. He's a good friend and has been on board Pharma State Academy on many topics, has discussed a lot of topics for the pharmaceutical industry, and has given a lot of insights to all of us. He has been in the industry for 20 plus years, and from sales to advertising to PMT and marketing to corporate and digital, whatnot, he has spoken on all. He has a mixed bag of experience in a variety of therapies, digital, public relations, and using media interventions in the past. He has authored several interesting articles on branding and digital media. Welcome, Pawan.
Hi. So today's nation wants to know, or the pharma wants to know.
Yeah, pharma wants to know, and lights, action, and it's pharma. Welcoming our second speaker for the day, Aman Gupta, Managing Partner, Health Practice Asia Lead, SPAG Fin Partners. Aman has been at the forefront of global health for over 2 decades, delivering integrated campaigns led by research, insights, and creativity with a focus on making an impact across stakeholders. His substantial body of work has centered on educating, informing, and promoting support for global health, environment, and health tech initiative to policymakers, public service leaders, and non-governmental organizations across the world. Throughout his career, Aman has built strong relationships with key international decision makers and has been a prominent voice in shaping the narrative of global health. He has a wealth of experience in a range of areas, including NCDs, immunization, sexual and reproductive health, infectious diseases, and use of technology in healthcare delivery. He has received numerous accolades for his work in PR and communication, including being listed as one of the top 25 innovators by Holmes Report Asia Pacific, and one of the most influential PR professionals in the world by PRV Global Power Book. Welcome, Aman.
Thank you, Swati. My debutant, I know Pawan has been around. So for me, it's kind of a first debutant. I hope I do justice to this platform, and really looking forward to this conversation.
We all are looking forward to your insights, Aman. And about our collaborative partner, this time it is SPAG Fin Partners Asia. It is a leading health innovation and communication agency that specializes in shaping conversation, influencing perceptions, and cultivating constructive knowledge through meaningful conversations and real stories. As the largest PR and advocacy firm in Asia, SPAG Fin is known for its bespoke communication strategies and innovative approach to PR and marketing. So this is about our speakers, and now we move on to the actual debates we are expecting at this forum. So let us start with the why. Why we brought in this session? Why is it the right time to hold this discussion? What changes are happening in the healthcare environment, which makes it important to know the nuances of public relations and media for pharma? So this question I'm putting to you, Aman. Why you think is the right time? Why pharma should consider getting this PR and media training or understanding this space and its nuances? Yeah, Aman.
So Swati, I think, thanks for this question. And I think it's very relevant in today's world. While health has always been a critical aspect of any human life, right? So health is related to your economy, health is related to your personal life. However, I think the COVID really brought the health at the center or the core of the conversation in the last 2 years. People became much more conscious about their health needs, about diagnosis, about what is the kind of innovations which are possible. And therefore, when you have an audience which is much more informed, it is our responsibility to see how we can really keep them educated, sensitized, and engaged on different health topics. So you have an audience who wants more information. It's a patient group or people who are seeking health behavior who wants to go more informed in a doctor's chambers. That coupled with the fact that the information is abundant available, right? If you start your search on any health topic, you will find so much of the information, and I would say equal amount of misinformation, which is available in today's world, to an extent that last year, we started working with WHO during the COVID pandemic. And one of the big issue which came out was this whole thing of misinformation, rumors and trust issues which are coming in. And that can have an impact on the industry in its totality. So there is a science called infodemology, which WHO coined last year. And I think in that particular space, as a pharma marketer, it's not just our responsibility, but also it's an opportunity that how can we really make different stakeholders informed? So whether it is patients, in terms of, and again, keeping in mind the role which we need to play, which is to keep them informed about what are the possible symptoms of a disease so that people can go early and diagnose themselves early and then see the right behavior. Initiate conversations between the patient seeking help and the healthcare providers for them to have a more meaningful conversation to find the right treatment pathways, and even conversation from between the doctors and doctors to say what are the newer innovations which are happening, what is really happening, how can they really take care of the patient. So if you look at therefore in all these aspects, so I'm just on your two stakeholders, which is patients and healthcare providers, but then you also have institutions, you have policy makers, you have patient groups, you have payers. The stakeholder ecosystem is huge. And at the end of it, the core is communication, how each of them are conversing with them, how are they sharing information. And that is I would say the DNA of any health system delivery. And I think as a pharma marketer, we have an opportunity that we are able to shape this ecosystem by deploying the right kind of communication tools in today's world to not just educate the people, but also bring it for our own impact, which we'll be looking at from business perspective.
Thank you, Aman. And the point that you raised about misinformation, that caught my attention because today if you search anything at Google, the information is there. It's not that the information is not there, but we still search for a reference point or a credible source to give us that information, even how much water one should drink. There are various articles that you will find at n number of sites, but yeah, the credibility and that communication has to be taken care of. Thank you, Aman, for answering this question. And next question to Pawan. But before that, I must compliment Pawan. You took it very seriously and came in an attire like you are actually going to do that media session. Thank you so much for that. And let me ask you the next question. As a veteran in this, with this relevant experience, you have been there, done that. Please help the audience understand the space. I am myself confused on the difference between what is PR, what is corporate comm, what is media. So you will have to simplify it for me, for all the people who have joined us today and who want to understand this space. Kindly take us through this maybe a presentation that you are wanting to share.
Sorry. Thank you for having me here. Very unusual topic for pharma, which is normally discussed, and more important, all the compliments taken except the veteran part. And the thing is, it's always fun to enjoy with whatever comes on the table and gain more experience and in new things. So PR is one of them. Last time, if you remember, we had done a very unusual topic of QR code in pharma. So that was something which everybody knows, and they are trying to find out ways and opportunities or some creative aspects to use it. For me, even PR is the same. So when I started getting into PR, it was almost like 15 years back in my previous organization when we used to give out information about bone health and all stuffs like that. So my take is, it is not that pharma is not doing PR. Pharma has been doing PR, but at a limited scale, at a scale on ground through their medical reps, or at the most at posters as danglers or whatever, information. But looking at the scalability and the change in behavior in the COVID, and like what Aman said, people want to know more, have more information and what is needs to be done. And today the tendency, I was speaking to some of the doctors, these digital savvy doctors, they always tell that before the patient comes to us, the patients always search for information. They search about the doctor, they come to the doctor, they discuss everything, they go back with the prescription, and they again recheck whether what is that prescription is all about. So that is a sea change which has come through, right? So basically, it is not new for pharma with what you call PR, but the scalability is there, but it was done at a very limited scale. So I hope this thing is visible.
Yes, yes.
Yeah, just hold on. Okay, so welcome. My take on this is through my experiences and my mistakes, a lot of mistakes which we come across, and all the views point are my personal, nothing related to my employers. It is my personal take. So at times I might be a little funny and little sarcastic, so don't take it personally. It's all in fun. So this is the first question I think everyone might have come across, and I have been through this question very often. So pharma mein PR allowed hai kya? So that is what one of the aspects. But having said this, there is also a moot belief which every one of us think, that whether it is politics, film stars, everything, from where we understand the word PR, or the page 3 culture, we think that whatever is the news is always hidden, the rest all is PR. But this is a debatable. That is why the word moot is what I mentioned. And more important, I believe that the media and the PR, scalability is very high. They have done some real good work. So I leave it for debate whether it is news is hidden and the rest is PR or no. But let us go further. So what is basically advertising and public relations, especially for the younger crowd who is sitting here? They always tell they are doing a film publicity. They don't do a film advertising. So basically, that is the difference. Public relation is anything related to, very simple, easy to understand. I'll not spend much of time. Publicizing and spreading, or creating a favorable or otherwise perceptions in favor of you or against somebody. Advertising simply is, we all know, we do that because so that the customer chooses our products than our competing. And there is one more thing which is in many companies, in pharma companies have, and many FMCG, they have a special team that is a corp team, that is a corporate communication. So that is more related to employee or stakeholder engagement and narratives from the company down the line. So that has been the tendency, and of late you see a lot of pharma companies also entering into this, though they had, but at a limited scale. Very quickly, when we say PR and media, there are multiple things which are involved. So internet, radio, television, magazine, newspaper, some were traditional, but now the internet has come up and it has overtaken television. And due to advent of these mobile phones and all, you'll see television sets are less than half the price of a mobile phone today. And that is because the whole audience has shifted over there. In terms of PR, I think you all know radio, TV, events, feedback, reputation, trust, information. So multiple things you are here. But as a pharma perspective, if you see and compare it with the FMCG or any other segment, there are a lot of finer opportunities here. When we say there is opportunity in each of these elements, pharma can enter within the limit of their compliance, and they can definitely do it. It depends how creatively we frame across it. Most important, very important thing, PR is very vast. If you compare whether PR used by a politician, PR used by a film star or a media house or a brand or a CSR or automobile industry or different industries, PR is very vast. Now, let me make it very clear. Everything of PR is not required here, right? Everything of PR is not required here. And all the things we should know as pharma marketeers. I'm speaking more towards pharma marketing and not as a company corporate, corpcom, because corpcom is a different ball game altogether. But when we talk about, I'm more personally passionate about what PR can I do in my brand, my therapy, my molecule, how I can keep it my relevance more important, even if, whether it is in the at any stage of the product life cycle, and PR can help increase the PLC of this brand or your molecule or your therapy. So at the outset, people like Aman and from the PR agencies, these are experts on how the news is controlled, and they know what controls the news. So many of us, they don't know what controls the news, and many of us may not know that. I was even not aware, and many of the newspapers, I think, Aman, you can correct me, in most of the newspapers, everything, the content is given by the reporter, but the headline is written by the editor. I don't know.
That's true.
So
That's
many
true,
people don't
Pawan.
know, much of it. And we blame for a wrong headline, we blame that reporter when the reporter has given the content, but the editor has written the headline. So that is a difference, right? So what is a PR literacy in pharma? So PR literacy, we need not go it as a scalability like your other things. Yes, our pharma brand managers, as brand managers or marketing people, we should focus on our therapy, our customers, how to make the patient's life easier. But this can become a very important tool. So PR literacy is now gaining a momentum. Yes, there was there. People were doing, but in the name of awareness, in the name of scalability, in terms of availability and all. So these were small PR elements itself, but the names were different. But now the scalability is more pertinent. And more important, we have more opportunities now with all these digital and new platforms coming in. So now what I personally feel is each and every brand manager, if he is media trained, so media training is one very important where people like, the PR agencies normally train, and very few even in pharma are media trained. So media training is altogether a different ballgame. You get an understanding how media thinks, what sells, what not sells, what kind of news is worthy and what is not, and what can be done around this brand or molecule or therapy. So that media training is very important, and if that can be a training aspect in among all the PMT, and if marketing teams take an interest, that can be a very good, interesting skill and interesting learning as well. This was something which I think 8-9 years back I had experienced when the Google was booming, and there were many things which I didn't know, right? So that can help in the marketing thinking. So more important, in many of the companies, the CEOs or even the heads or the BU heads or the vice presidents are not media trained. Forget the marketing team or a PMT or a marketing head. So this is something which I feel all the PMT or the younger crowd or younger audience we have today should take interest and understand how media thinks. And then this will give them, open the doors in thinking the newer ways in building the brand. And more important, what makes the news? It is simply newsworthiness. Right? I was mentioning what makes the news, why it comes on the first page, why it comes on the second page, why it comes on the third page, and why it doesn't come at all. So newsworthiness, whether it is you want them to know or the people want, people means it can be your here, it can be your doctors, your patients, your pharmacists, your stockists. So whether they want to know or you want to know, or they should know, right? So these are the parameters. Now, this is a very interesting slide, and this is my favorite slide out of all this. It's a more insightful. Take one step back. Whatever viral, whatever WhatsApp forwards, whatever fun, whatever reels you see, whatever content you see today, in on the internet or on the TV are either around these three. Either it is fear, either it is hope, or an anger, right? Think. I mean, maybe half an hour back, you were watching some reel or on the Facebook, or you forwarded some joke. Either of these three. So either it is fear-induced or hope or anger. And most important, there are 6 or 7 things which I feel I have listed based on my lookout or my experience. These are the things which gets viral or gets into the news. So these are the sticky stuffs for any human, whether it be it a doctor, pharmacist, or anything. As a human, what is the relevance? Is there a controversy? Is there a human interest and the entertainment? So these points, if you see, like for example, in the first lockdown, in the initial days of lockdown, when there was no trace of any COVID vaccine or anything, which company is coming, and there was things were spreading, and there was rumors like what Aman was mentioning. The news and PR went with bridging the gap between the hope and fear. Right? That was an insight which came out, if you notice this thing. Now, controversy. If you see some of the TV programs, reality shows, they build up these controversies so that people, get attracted. So though people don't want to know, but here the case is, the organizers or the producers want the people to know, so that there is a awareness of these people. So this slide is something which is very important for all the pharma marketing teams to understand where your brand or where your therapy. I'll come back to the slide in a later stage. A little quick brief, I'll not take much time on this. Traditionally, print and print newspapers and magazine were dependent for the PR teams or PR and all. But what had happened? How this has come? A quick glimpse of what has happened in 30s and 40s, especially in radio, and Aman will be able to throw more light on this. I don't want to dwell upon what has happened, but there was a psychological and propaganda strategies during the business communication during World War II, and this was very evident in World War II. And that was a time when you see this graph of theory of cognition, or the adaptation of products, you will find a very peak curve of radio, other than other things. So this was a time, because there was no television or anything. So that was a time. So that was a scalable aspect. 50s and 60s, emergence of media, and that became a corporate communication tool. Especially this was in US and European developed nation in those days. 70s and 80s, more related to some of the scandals. If you Google the scandals of 70s and 80s in terms, crisis management came out as one of the big advantage for the company. So this is how, like what we say, brand management as a concept started with Neil McElroy. This was something like crisis management started with these things which happened. And that was a need of the hour for large companies, because there was a narrative from the company going, there was a message from the company going. So companies were thinking in a different way. But the most important aspect, which I want to focus here on these two, like advent of internet. This has changed the way business has interacted, which we all know. I don't want to spend time on it. People have started tweets or posts or Facebook. They have their own official handles. So earlier, what used to be a written communication as a press note or a press release, today, if they tweet or post something, that becomes a communication. So that is a way. That is also a PR. So influencers, big data, and it is now gone. I'll not elaborate here. It has gone now that with the data, you can target the very specific segment of customers. So this is where a quick history brief where it has happened. And now with tech, you can't avoid digital or digital media, because it has helped reach wider audience. It is more economical than earlier, and at the speed. Yes, within seconds, you get the information which used to get earlier when in our younger days, wait for the next day's newspaper to have elaborate information. So why it happened? Very quick data which I want to share, very interesting because it is correlated. Now, Indian internet had two issues when the internet started booming. two things. One was smartphone and data. Now, both were taken care. How? Data was taken care when India is one of the cheapest with data with at less than 10 rupees GB. And in 2017, there was 350 million, that is 35 crore almost smartphone users. So it was booming, and these are all Google Analytics. So I would also recommend think with Google and Google Analytics. Google Trends are very good information. You can go check on Google. They give a lot of information what is being trending, whether it is football or cricket or health or whatever. So these are some data points. More important, very specifically, how this changed. And this has been both for digital as well as PR messaging also. In 2010, there were less than 10 million active smartphone users. And then when the smartphone came below 10,000 mark, the cost of smartphone, which I mean below 10,000, then 10 became 100 million. Now, when further smartphones, all these smartphones have what do you call competition, and more number of brands started playing in, and the smartphone cost came below 6,000. It became suddenly from 10 to 100 to 300. So what is happening? Currently, we have around 800 million television viewers. And more important, every month, this is what Google Analytics says, every month, 1 crore new smartphone users are there. Additionally, most of us carry two units. That is also counted in this. So all these 1 crore new people are coming on smartphone because they are content hungry. Note this point. I'll come back to this. A lot of data here, but I'll just pinpoint very specifically. What is the opportunity? The first point is here, wherein over 60% of people have searched for consulting a doctor. Then 1 out of 2 people, this was earlier data, consumer seeking personalized information for brand searching queries like how to homeschool kids. Now, this can be one information, but what I see here as an opportunity is how to homeschool kids. So any pediatric brand, even cough syrup, antibiotic, whichever pediatric brand, you can associate that with their brand and help the mothers develop the content and help them, so this can be additional opportunity. 37% online comes from rural. So this is a big thing. This also means the local language, not just English, but even Google has understood that it has to have multiple languages for to be relevant in India. So these are few of the points very interestingly. Now coming more important. What is health related? So those were the general related. Now I'm talking more towards health related. Now this is before COVID. I'm specifically putting the data which is before COVID, because after COVID definitely it was high. Even before COVID lockdown and everything in 2019, Google received 1 billion health related questions every day. Imagine what is it. Now, 7% of Google's health search, Google's daily searches are on health. Health-related searches on Google are 70,000 a minute. So these are some very startling facts. I'll come to the opportunity part based on this. A little bit more. Search bias is also there. Search bias, what I mean, search bias is most of us educated people don't believe on Google, right? Don't believe on Google. That is a search bias. And many people have stopped believing on Google as well. But still, if we have organic and authentic content, still we can do a lot. And this is where the role of a brand manager or a pharma company, without pushing the brand, which is against the compliance, you can build on the therapy and so many aspects. Now, the most out of these 3 pointers below, imagine 41% of Indians, this is Indian data, 41% of Indians at least once a week search something related to health. So this is a very interesting data outcome. How many times is a doctor's visit? Now, we all know a lot of cases, film stars we see having cardiac issues and all. People are getting ill at a very young age, and that too at a chronic conditions. And these are the 2 cities that I have specifically mentioned. This was studied by Practo. that an average Bangalorean goes 4.8 times per year to a doctor, some or the other way. So 4.8 times per year. And the least was Delhi, 3.8. So imagine 5 times to at least 4 times an Indian average in 7 major cities, wherein almost like 35-40% of the industry's revenue comes from, the visit pattern is to the doctors. So these are some of the pointers which I wanted to highlight. And before, there's a lot of things to discuss, but before I bombard too much of data and all, I think I try to put my point in what is the scalability, what is the opportunity. Yes, pharma is doing PR, but maybe with a different name, with a small, in the frame of bracket. But now my intent is, or my interest or passion is to open up the mind, think of new ways how we can. And some of these ideas we'll discuss and debate with Aman after a quick discussion. Over to you, Swati.
Thank you, Pawan. Thank you for taking us through the basic. I think these slides will help us retain some information about PR journey, history, why it is important, how data is helping us, put our brands in people's minds in the right way that we want to. And I'll come to questions from your slides only. The first slide that you showed was pharma mein PR allowed hai. This is one question that is in almost everyone's mind. Even my mind, it was there. Ki is pe legalities, the policies. We in healthcare industry, we restrict ourselves to what is only compliance related. So that question I would like to ask Aman. And the second question that came in, and it is coming in chat, and as a question also, is about the training. So requesting Aman and the team at SPAG Fin Partners to please help pharma companies get this training on media and PR things. So these two things I'll cover. Aman, would you like to answer around the policy? Kya allowed hai and the legalities of this?
Okay, so Sati, first question, and the answer to that is yes. As simple as that. The public relations for pharma is very much allowed. And I think the reason why we need to understand, I think just to sort of ensure is that there's a difference between advertisement and publication, as Pawan sort of started on. These are two very different things. Advertisement is controlled by what we have is as a part of our uniform code of pharmaceutical marketing. And that's where what you're doing is you're doing a direct to the consumer advertising, whether it is about your product, whether it is about your newer innovation, whether it is about, now that has it is certain legalities and compliance. And what it basically says is that at no point of time, a pharma marketer should be promoting its molecule or a brand to the consumer directly. Because as a healthcare person, we know that the best person who is there in the system to advise a patient on what needs to be taken is the doctor. So therefore, at no point of time, we as a pharma marketeers would be engaging with a consumer, caregiver, or a patient to say, this is a brand which we should be taking for XYZ disease. That's not allowed. And I think that's not just from our core of pharma marketing, but also as an ethical practice. We all know we are part of it. I think all of us who have done, graduation pharmaceuticals, forensics is a part of, one of the course which we do. So I think that's something which is clear. However, let's look at what public relations is. And I think Pawan, thanks for sort of setting the amazing ground for me. So public relation is where you are sharing news and information through a third party, which in this case is a media and a journalist who is the filter which will sort of take that information. And the journalists also understand what is the kind of information which would be right for their audiences. So when we look at any kind of a PR campaign, it is more about, as I said in the previous, building conversations. So just give you an example here. If, for example, we were running a campaign for one of the companies a couple of years back, was for psoriasis. Psoriasis as a disease while we as a marketers in the pharma industry might know, but people outside still do not know what psoriasis is. So the first is to make people aware what psoriasis as a disease condition is. Now, when that has to happen, this is where the public relations comes in. As a PR, as a tool could help build disease awareness. The second is that as a part of that integrated campaign, we were also able to build a very strong storytelling through emotion to the people who are suffering with psoriasis, that you don't need to be suffering, because lots of people who are suffering with psoriasis will not even go and talk to the doctor. That's another challenge, right? As a marketeer, I know there are people who are suffering from certain diseases, but because of either the lack of awareness, whether because of the stigma, or whether they are kind of sort of saying, I just want to live with it, they will not go ahead. So if we can even expand the market, that's a huge thing, from by PR, you can shape the market. If there are 100 people who are of known disease condition, you can take that to 1,000 or 10,000, because the health issue in India is so huge. You're talking about 1.4 billion people. Now, that was the other part which you're able to do. And then from there, driving these people to go and talk to your doctor, because there is a certain new innovation. We will not talk about the product or a brand per se, but we can say, go and talk to the doctor. There is certain new innovations which can help you get the clear skin of psoriasis, right? So what has happened? We've connected the person first to take a journey saying, I have a problem, so I need to recognize the problem. Second is that if I have to recognize the problem, I would need to go and talk to the doctor. I should not be suffering in pain, right? Third is when I go and talk to the doctor, I'm saying, doctor, I have heard there are some new innovations coming, and can you tell me more about it? I think this is connecting to what Pawan said. People now go more informed, right? So when they are searching, now they will go to the thing, and therefore the PR also ensures that when people are searching in the digital or the social space, they are able to find the relevant information, which is from the trustworthy sources. So the trustworthy sources are either the brands or the companies. Finally, people trust companies, right? If you are an Indian pharma company or a global pharma company, if you're sharing information, it is a trusted, because you would have done your enough checks and balances before you put it out. Or if it is a peer-reviewed paper, or if it is coming from a media house, these are things which are trusted by the people. And therefore, they have certain information about certain new innovations. They're going talking to the doctor, and you're able to shape the complete patient journey through this thing. So you are increasing the market, you're building the market, you're shaping the market for newer innovations, which might be there in that particular therapy area, and you're making people to live a more healthier side of it. And this is all done in a manner where just sharing information. You're not advertising, or you're neither promoting your brand per se, and therefore from a legal and a compliance part of it at any level. It's not just because of anything, it's only Indian or global. Everybody has a very, very strong ethical committee, very strong medical legal ecosystem. And we as a specialist firm, I think that's the other part, that from a public relations, you need to be a specialist to understand these nuances. Like as an SPAG firm, we have been operational, and for me personally, I've been on the other side. I would have been on the other side of this table, 20, 22 years back when I started my career as a brand manager, but then I sort of shifted to the other side. So this is where the team at SPAG fit, because they understand the nuances of compliance, they understand the nuances of regulations, they understand what does a medical legal ecosystem exist, and therefore also they understand what public relations, thinking of. We are able to connect the dots and ensure that any campaign which we run, based on the objectives which are mutually defined and agreed upon, it is compliant. So just to end again, PR is a very, very strong tool for the pharma industry. And that's something which should not be, an option. It should be at the core of any campaign which a pharma market is in.
Thank you, Aman. And
I have a take here.
yeah, Pawan.
Very interestingly, the way the technical aspects which Aman had mentioned, for PR and pharma, typically when even I started understanding or trying to learn, and I'm still learning, very honestly, a lot of things in PR, even I don't know, because I'm scalable only till the pharma aspect. As a brand manager, Pharma PR doesn't mean putting a hoarding on Nariman Point about your brand. So understand this. This is the first aspect, right? A typical PR, which I always give example is like we always say, medical rep has to go to the doctor repeatedly so that the doctor remembers. The same thing is even used by automobiles. I give this example: if any new car is launched, on the same day you'll see that on the front page of a newspaper. You go out, you'll see the hoarding. You open a Google or anything, you'll see the ad. Multiple times they bombard. So same thing we also do. Secondly, as a brand manager, we gave out posters, we gave out danglers, we give out patient education material. This is a form of PR itself, because you're not promoting the brand, you're promoting some health or this thing. But now that scalability can be improvised much, much better, because even 20 years back, when I was in ad agency, I used to go to multiple companies. In one team, one brand manager, we had suggested some patient education. At that time, there was no Google, WhatsApp, but obviously. When one brand manager, we had suggested some diabetes-related patient education leaflet. The team gets understanding, and there was a 2-3 more calls from the other brand managers. Everybody wanted to do patient education in the same team. See, understand, patient doesn't need education, they need relief. So that relief can be percolated in what he told as an emotional way or a memorable way through PR. So that is a scalability. Another thing in terms of launch, acquisitions, or any other changes or price drop, these can be a scalable aspect. Other aspects, it is not that you put everything on a mainline newspaper. There are platforms which are doctor targeted, where only doctors come as an audience. You can target those just to reach out to these doctors. So lastly, but most important, when a pharma, since I am speaking on behalf of a marketing aspects as a passion and passionately, you need not talk about molecule, you need not talk about the brand. You just need to build a narrative so strong that it correlates to your brand. So you, as a brand manager, you work on the therapy, keep the therapy relevant, keep the molecule relevant, don't talk about the brand. And there are many, like, we used to do WHO question answers for osteoporosis. Yes, no, like what he said, we are not doing that. You take my brand, you just answer these yes, no, and go to the doctor. That's it. And it augments through our medical rep that anybody like this comes. So this is where the loop is there. So this is a new opportunity, but it has to be done thought over, not like earlier what LBL or visual aid and all that keeps on going, but this scales up. So today, if you are giving a poster, you all know, I mean, most of you are on field. You go to any doctor, you will find 50 posters, one over the other. Half of them are torn. Nobody is bothered. Now, instead of giving too much of content on poster, can we give that typical AID, attention, interest, desire, action? So there only attention getting, and give a QR code or something and divert them to something else, so which is more engaging than a simple one-liner poster. So this is my thought.
And Pawan, really, just based on what you said, I think there's one more aspect which I sort of wanted to extend to what you said. See, one is what you're sort of talking to a patient or a consumer per se. But the second part is who is speaking to these people.
Yeah.
We as a pharma industry are only a catalyst, but the person who will be speaking in the media will be a doctor. And because the reason I said is because when I started my career in brand management and pharma sales, one of my pharma trainers said that you need to get your doctors to speak the same language which you are speaking when you're telling them about any molecule. So when a doctor is speaking, right, because for us messengers as a public relations practitioners will be my SCPs, depending upon whether it's a neurologist or a cardiologist, or an orthopedic. Now, when these people are also engaging through the PR agency to speak on a subject, saying there is a new innovation or there is a thing. So, for example, in our health, there is an innovation happening. It could be a new molecule, or it could be just a delivery system from, say, a thrice a day pill. If I'm shifting to, say, once a day or a once in a week or a once in a month, now the doctor is also getting engaged, and the more they speak into the media, they are also starting to look and sort of start thinking, getting aligned, saying, okay, now I have a newer thing which I need to be prescribing. It also changes in the prescription behavior of a doctor. So look at PR from two sides. It's shaping the market, but also it's adding to the shaping the mindset of a doctor, which goes beyond what you can do at an in-clinic. So in-clinic, you take them to this level, but there are 10 other people who are speaking. But through the PI, you can really shape the behavior and the thinking pattern of the doctor. Plus, you as a brand, you are working along with them. There is a stress and leg for engagement, which is going beyond in-clinic. And in India, like a thing where there are so much kind of the lack of time to engage with the doctors. This is something which is a big ask, right? And you started that. Most doctors saying, how can you, help me, help patients get more educated, right? So this is the way where a partnership can go beyond. So that's as I want to say, this is something which is really happening. And then there are so many other ways, you can do a symptom checker on online nowadays for people to do. You can do web, online media collaborations where you can get conversations happening like this between a doctor and the patient organizations or the patients, get them to be more educated. So the opportunity is huge out.
Yeah. Thank you, Aman and Pawan, for chipping in and answering this question. There are very pointed questions coming in. And from both of your talks, I understood this, that in the ecosystem of pharma marketing, one of the emerging players, and I think it would be one of the pillars, this media and PR thing has to be there, taken seriously as a, in the pharma marketing ecosystem. One very pointed question, Aman, if you can just answer it within one line or two. Usually when PR and media comes into my mind, I think it's related to the HQ communication, headquarter communication team only. But since social media has taken over communication spread, can I, as a field employee, I also do PR or media branding for the company? So where is the regulation coming on how it happens?
So I think, Swati, is not about the HQ or working at a state or at your own, territory which you are in. The idea is that the messaging needs to be kind of similar, because you cannot see difference in the different point of view. So when we define any campaign, it is something which is done at a pan-India basis. So while my central thinking would emerge at one phase led by the marketing team, but then we do coordinate with the marketing and the sales team at the territory level. Because if I'm engaging with a doctor and engaging with the media, it has to be very localized. Because if Lucknow is a geography which I need to be talking in Lucknow, because what I say in Bombay will not reach Lucknow. So it's very geographically targeted at all levels, whether it's my traditional media, whether it's my social media, or whether it is my digital marketing.
Right. And we'll move towards a topic on which many questions are coming. How, what is very relevant for pharma marketeers in PR and such sort of questions. So stay with us. There is another 10 to 15 minutes of slide deck that we will be sharing with you and telling you more about ideas and examples. So Pawan would be helping us out. Pawan, please help us.
Yeah, hi.
These questions are coming in. Yeah. So majorly, what are the focus areas or context areas?
I can understand. I can understand what people might be coming across. So similar were the questions many years back when I started understanding. And a typical behavior when we say is, "Hum FMCG nahi hai, we can't do, hum kuch nahi kar sakte." No, but it is not the case. Being in regulations, being within the bracket of regulations, being within the compliance bracket, you can be more creative. Like what Aman said, it is not about promoting your brand or anything, but you are promoting a purpose. You're promoting a surrogate theory, which narrative, story, which correlates indirectly to the patient and induces him to go to the doctor. And simultaneously, the loop is completed when your medical reps or your field team or you go to the doctors, and there is a ecosystem of that messaging. And this is very important. And many of, let me tell you, many of the big pharma brands built always had some or the other PR element by design or by chance. It had that. So if you, I don't want to name particular brand or this thing, but if you have any big brand in a company, what they have done earlier, there would have been some PR element, though it may not be called in the principle of PR. But for me, the biggest gap here, like somebody asked, what can be done through this thing? What is the gap is most important. And the gap is pharma principle revolves around push. I have launched this, so I'm going 50 doctors target, 20 doctor sampling, repeat visits, without knowing whether the doctor is uh, wanting it or no, like any new diabetic drug or anything. So I remember talking to some of the doctors, even leading doctors over a period of time. Whatever amount of advocacy or KOLs they are, whatever amount of support they might give you, at the end of the day, the common thing which I understood, insights which these doctors only told, when I sit in front of a doctor, I might come and tell you good molecule, good this thing, everything. But when I sit in front of face-to-face patient, the first thing that comes to my mind is whether this guy is able to afford this or not. So that is the first thing somewhere innately. And then they weigh between the importance of, risk and benefit. So that is something which comes. So pharma principle is always push. One patent of hundreds of brands come in within a span of weeks, and to the level that doctors have now started putting posters outside that so and so molecule people need not meet me. So that is a level. But PR is a pull. So this is where pharma has not used it completely, except like very recent example, COVID. Everybody wanted it. So PR was a natural, organic PR. They got an organic PR and people wanted it. So that was a pull factor. People came to them. So how can you make that happen with your brand? Your half of your, your supplementation brands, patients may not need it, but how do you create that need? What is the gap? So instead of pushing it, it has to be a pull. So this is the biggest gap which I feel in terms. And imagine, more than 200, around 150, I think 150 to 200 SKUs are launched every month as per the market data. Where do they go? After 2 years of launch, they are still struggling for availability. They are still struggling with most of the brand, not all. So more than 200 SKUs or some new brands come in. After 2 years, they are still struggling with availability, even awareness. Because either MR ne chhod ke gaya, then it was not launched properly, it was not made available across. So normally tendency is like, you select 20 doctors, 20 into 3 chemists around, so 60 chemist availability, and that's all. And what is the number of chemists in that headquarter? What about that? How will you go there? What is the scalability? And at the end of the day, we normally tend to be happy with when the brand comes 5 crores or 10 crores, where we can think of much bigger with PR in picture. So what I feel is we figuratively, pharma is like kissing too many frogs to find a prince. So that is what I wanted to say in that. So what can pharma brand managers do? So very quickly, if you want to note, these are some of the interesting points which I would all of you want want you to think, and few things, but you guys might, after reading this, might get much better ideas. So do share them as well with me. Before going further, can anyone know, put it in the chat box or quickly tell without wasting much time, 1, 2, 3, 4, and 5, which ribbon stands for what? Anybody on the chat box?
Okay. Again, repeating the question that Pawan asked, which color ribbon stands for what? In the chat box. Red for HIV. Okay, the first answer.
Okay, quick. Another 10 seconds. Whoever is wanting to answer.
Which color ribbon stands for what? So
there is a reason why I'm asking this. And the reason is PR.
Yellow suicide. Okay. Googling, I think. Many people would be Googling simultaneously.
Okay, I'm not giving the time now. Okay. That is unfair. Okay. So very interestingly, most of you, I think, know HIV as red ribbon. But do you know that yellow ribbon is also for suicide prevention awareness? There is COPD awareness. Green is for mental health. Pink is for breast cancer, and orange, God knows, everybody has taken the orange. UN International Day for Elimination of Racial Discrimination, leukemia, multiple sclerosis, spinal cancer, kidney cancer, so many. Now, I think in the audience, none of you were able to identify all the 5. And the reason is PR. Because the HIV ribbon was so much sold that it came to your mind. Max, your second is breast cancer, the pink ribbon. So this is the impact which makes. And you Google it now, every color in the Pantone shade card, you will find different ribbons, and somebody has taken it, but nobody has done a PR around. And this is what happens with pharma brand. And we launch it, but we miss out on multiple PR opportunities. And that doesn't mean, having said that, every brand requires a PR aspect. So my take here is awareness and outreach is the most important aspect, which we often miss out, and we have an opportunity. And from traditional way of thinking, LBL, first visit, second visit, and this thing, and wait for the prescription and all, you can make much more out of it. So this is where PR helps. No, I want to own that category. You know, we always hear this word of in the brand plan meetings. I want to own the category of diabetes. I want to own the category of rheumatoid arthritis, or a number of things. So owning the category is not an overnight job. So when PR is said, now many of you might be thinking, budget kidhar hai? You know, PR budgets are not much because you need creative idea to be having that fear, hope, and anger, you know, triangle. So owning a category is not, you might not know, you might not do a particular thing every day. It can be once at a milestone. Milestone mean at a launch, or something big is happening, some event is happening, you are bringing out something new technology. So that is a milestone. Now, 3 months later, you bump up with a new wave. So that is a second. 6 months later, you add on to the second wave. So what you're doing is, apart from your regular marketing activities, with these kind of PR activities, you are staying relevant through the therapy. So you are keeping the therapy alive. And especially if you are the leading brand, you know, 1, 2, 3 as a top brand, it is onus of that leading brand to expand the market. Don't expect the other smaller brands will do. And if they do, they might scale up much better. So this was just an example to share with you. So my first take is, start with the brand plan. And brand plan is not just about filling the formats, IMS, CMARC data and all just to fill it. Please start with the brand plan, include thinking of this thing. How? Sell the problem for which your product is a solution. So normally what we do is in the visual aid in so and so, so and so. But before that, at the most, it was started 20 years back with teasers or AV launch and all. But can we go a step back and start narrating in public in different ways so that the awareness increases before your launch starts, right? So what is the problem? So problem can be defined in whichever indication. So, you know, like you have a plug-in opportunity when any of the film star has a heart attack or a heart operation, so much of articles are written. So they are the very good plug-in points for a brand with a cardiac, or a company with which has a dominance in cardiac or diabetic stuff. So sell the problem for which your product. So this is what a PR narrative can build up. Second, you can reach much faster than your medical reps. Medical reps can reach later, but before that, through digital, through PR aspect, you can reach targeted pharmacists. And also, as a koi brand we are launching, so you can run some campaigns for availability and all, instead of your medical rep going and begging the pharmacist to make it available or anything. So many of the things can be done. You can do a talk of town and top of mind recall about the therapy. Again, not about the brand. I'm not propagating that you should promote the brand on social media or anything. So that is not allowed, and even I am not in one. So talk of town is the therapy aspect. So how this can be aspect and build up a top of mind recall. Narratives on the need. So there is a need, but the patient may not be knowing. So these narratives can be built up. Patient stories can be built up. So this was a case, this was a patient, you know, the PR teams can help you build up narratives on stories, you know, build up a patient story and put it in the format, which the other patients, related patients, or somebody who's suffering in that way can relate it to, right? So this is one aspect. You can, yes, definitely we all do this. We have target audience data, so we can directly reach to the target audience. So you know much better than me in this. Second is, any brand which you have 2 or 3 crores, all the brand managers sitting in the room, just after the session, go on YouTube, search your brand name. You will find somewhere some guy sitting who is not even qualified, doesn't even know how to spell your molecule, has created a review video of your brand, right? Do you want that to be seen by the other people? So this is something which should be a part of brand plan. So if I'm launching a brand plan, I should have my own unboxing or reviews. You know, telephone unboxing has become a fad now, because that is a review format. So that can be one of the good aspects. So instead of some random person, uneducated person reviewing your brand in a wrong way, rather you put a good content, make it a review through a qualified pharmacist or something. So you can post it on your YouTube, your website, or whatever, allowed as per your compliance. So social media conversation, like what Aman was mentioning, social media conversation on the therapy, on the ailment, like psoriasis example he gave. So everything can be done, even for cough, cold, everything can be done in terms. So these are the areas. So are we there on the Google? Again, are we there on the Google? Are we there? Are we there on the different social media without circumventing the laws? Now, there is a very good this thing in digital, which is called as plugins. Now, if you search your brand name on Twitter or anything, there might be some hashtag, there might be some negative or positive comment. Who is answering them as a brand manager? If there is a positive, somebody should there be from the company to thank that person. If there is negative, somebody should come and explain, attend to that. So that is a plugin. So what happens is the public at large will understand that somebody is looking at, somebody has put a negative comment, the company has approached them in a positive way. So that is where the crisis management comes in. Somebody has put a positive thing, you can build a narrative, reactive or proactive this thing. So here the stories build up. So the social media and PR will help you. So PR teams always have this, keyword search around your brand. So they have a separate set of services for this. So this is where. Now, and more important, how can we create a larger purpose around your brand? It can be a simple cough, cold, or it can be rheumatoid arthritis. It can be anything. Can we see a step up? Normally, what we see a brand launch means a visual aid, LBL, chit pad, a different strategy means a different shape of LBL. So that is what the limitation which we have. And Q2 may alag different shape chit pad. So can we think of much larger purpose wherein you can involve a doctor? I don't want to give a particular example, but like example, if you have a cough syrup, right? A cough syrup, we always cough. So this is a very traditional example, which if you go to any chest physician, they will know what kind of cough they can understand. So can you link that purpose into a PR? So do you know your cough? Har cough kuch kehta hai, something like that. Har cough kuch kehta hai. So every time you cough for something, it shows whether it is what kind of an indication, what is the issue. Half of the diagnosis is there. So that induces a person to go to a doctor. So that is a larger purpose, and your doctor will be more happy, right? So that if doesn't exist, don't come back and say don't give up, because it can never be a story. It doesn't exist. You can create a story. Hamesha we have seen, I have thought enough, abhi mera dimag kharab ho gaya, now I don't have any ideas. It never happens because you have not thought enough. So that is my take on this. Quickly, multiple areas, positioning, repositioning, and depositioning. So suppose you are having a brand, you can strongly position with PR help and all. You can reposition your brand with PR help, because if you reposition, for example, if you have a approval in one particular indication, and tomorrow a DCGI or some international authority has given additional indication, how will doctors come to know? Because it has been in one spot and somewhere in USFDA or your DCGI one letter. How will that? So can we build a narrative on repositioning your brand? So you have got a new indication, or you are now priceless. You're priceless but priceless, or something like that. So that thing, depositioning your competition. So you are one molecule, you are another molecule, you are one therapy, you are another therapy. So if the other therapy which is fading out, I'm just thinking randomly whatever coming in my mind. Suppose you have come with a new therapy and there is one therapy which is very prominent among the senior doctors, various different specialties, but you have a new therapy. So you can deposition the earlier therapy through PR activities with the new thing which has come. So all three things are possible. Biggest opportunity which pharma industry I think is missing is the prevention market is more than 10 times bigger than the treatment market. And probably if you see top 50 brands of Indian pharma industry, you will see how many are treatment and how many are prevention. So prevention area is something which is very prominent. If you have a brand of hematinic, if you have a brand of supplements, if you have a brand of added advantage, co-prescription, adjunct therapies, a lot of things can be done around this and making it more relevant. So that is where I call it as therapy shaping and scientific relevance to building up. And scientific relevance is also important, wherein it is an old molecule, but still it is important. But doctors are not interested. So can we create narratives around it still relevant, right? I've seen many companies doing activities or content development or talk development for a molecule which is 25, 30 years old, and all the doctors know, but still they are doing it. It's a very good aspect, and they are targeting doctors through a doctor-only platform. So doctors are getting to know the brand name. So that is very important. And if it is a doctors-only platform, you can directly place your brand name. Otherwise, you can't put it on the Times of India or any other mainline. But if it is a doctor-only platform, you can definitely do. So science relevance around should be there. And more important, if you see all these big brands, any big brands, whichever company you are, you will see that the end essence of this brand built was on science. So please don't move out of the science. Don't move out of the therapy in the name of creativity. So be rooted to the science aspect, on the concept aspect, and that you convert into a story, and that is where PR scalability is there. Last couple of slides, important SEOs, keyword indexing. This has become very important these days because there is a good old saying, today, like initially I said, there is no rocket science that if I don't know something, I'll go directly to Google and search, right? Now, why SEO, keywords, and indexing is? So suppose you have built up a content, everything, but if you are not featuring on Google, because there is a very good old saying on Google search, right? And that search is, if you don't want to get caught, hide the dead body on the page 2 of Google search, right? So nobody goes there. So if you are not there on the first page of Google, then better don't be, right? So that is where are we capable? Are we working on being on the first page of Google? So that is what PR for me is, right? If I search for cough, can the patient come on something on my cough brand page? So this is where, if you want to, if you have created committed a murder, hide the dead body in the page 2 of Google and you'll never be caught. So that is the beauty of Google. So your target now is be on the first page of Google. And doesn't mean log soch rahe honge itne sare honge to sab log sunenge, sab aayenge. Google has something called as canonicalization. Every 3 months it keeps repeating. So that is where your PR, your digital SEOs has to be consistent and not one time and finish. So normally I've seen ये 3 महीने में हम digital करेंगे, बाकी साल कुछ नहीं करेंगे because there is no budget. No, better don't do that 3 months. And if you can't scale up to 1 year, don't do it. So that is my take. Last but not the least, crisis. Remember all these film stars or companies like Tata, companies so many, they immediately give an apology before even anything, right? Any apology, like recently Tata underwent some issue in the flight, or any other company having any other behavioral issue with the people. So why is people forget the crisis, but they remember how the company or the brand reacted. So your reaction to the crisis should be very positive, right? And more important, Winston Churchill once said, don't let a good crisis go waste. So all the crisis is a good crisis, provided you know how creatively to use it. So this is where the PR aspects can help you especially for big brands. So my last take, media train yourself, utilize PR to pull before you push. Yes, push is required through your physical medical reps and all. It is not that you are replacing medical reps, you are helping them through PR activities in a much better way rather than the traditional way. PR is next in line. And finally, my take, when you write this is my learning when I started writing PR note or the press release. Right, be crisp. It is not your visual aid, it is not your LBL, it is not your product monograph to write such a long, because this is what press will say, this is what public will say, and this is what media will say. And one more thing they always say is this. So that's my take on PR. So be quick, be clear, and come to the point what you want to say when you are in front of public. Thank you.
Thank you, Pawan. Thank you for taking us through it in a very, I would say, funny manner. We all got your message, what you wanted to say. So, hum कहना क्या चाहते हैं? Let us move ahead with कहना क्या चाहते हैं. Aman, 2 questions I will quickly put to you because our participants are very, want to ask questions, and I want to open it for them also. 1 or 2 questions, Pawan, please pitch in. From Farhana from JB Pharma. When we are saying public relations, why are we putting doctor relation as a part of PR? Essentially, doesn't it mean addressing the general public? So please clarify this thing. PR is understood as just addressing public and not... to
whom is this question?
Aman or Pawan, anyone who want to just quickly...
You want to take or let me take?
Go ahead, Pawan.
Okay. See, public relation per se is a principle, right? Now, when we say principles of marketing, I think even Philip Kotler has never written much of pharmaceutical, but we all pharma people read principles of marketing from Philip Kotler. So that doesn't mean hum pharma mein hai to Philip Kotler nahi padenge. So public relation means public. For us, public is doctor, public is a patient, public is your stockist, your chemist boys, everyone. So PR per se is a ek soch hai. You keep public as a patient, you keep public, it can be a patient's relative as well. It can be a patient's caregiver, especially in treatment like cancer and, ailments which dependent on the family. So multiple things can be done. So that is my take. PR, it doesn't mean only public. For you as a brand manager, your PR is towards doctors. So choose those where are very doctor specific, simple.
Yeah. Thanks, Pawan. Next question. We are talking about PR and media. There are many legalities that need to be kept in mind with formulating any communication strategy. Can you state some basic do's and don'ts? I think we have gone through that presentation, so we'll not repeat. Next question is, when in brand life cycle, would PR and media be a correct strategy? Aman, very open-ended question and very opportunistic question for you.
No, I think Pawan definitely talked about it, but I think public relations as a tool is relevant at every stage of brand. So whether it is, and it has to be at the center of your strategy, it's not like an afterthought. So whether you're launching a new brand, whether you are getting a new indication, or you're looking at as a, you are kind of a competition to a leading brand and you want to get a next lease of life to the brand, or you want to give it a thing. So public relations as a tool is relevant for everything. You need to define your business objective, and public relation can help you achieve that business objective at that particular stage. So for example, as psoriasis, we were launching a new molecule, so that was important. Second is when we let's say do a campaign where we're talking just the fact that why there is a deficiency of say vitamin D amongst the women, we are sort of doing, let's say, a campaign for a brand leader or for somebody who is trying to be a brand leader. You're trying to create a category, right? And you're using the doctors as your public to build that conversation and getting people to come and say, okay, can I be at because of certain symptoms, I believe I have a vitamin D deficiency. So you get a diagnosis, and then, because the doctor is doing in partnership with you, they know that this is a brand which is more relevant. So that could be just because it's a brand, it's a kind of a very, very large open category. So it's not something which is relevant at one stage. It's relevant at every stage of a business or a brand life.
Okay. Thanks, Aman. Pawan, you want to
One
add
small
something?
take. See, if you see the bracket of PR, it doesn't mean that every time every brand requires a PR. What is the purpose? See, if your purpose is defined, many of the brands may not require PR. But if you have a purpose around and build it, it can become a larger than life. It can scale up to much better. It can reach, outreach is much better. So that is where the importance. So it's all based on the thinking.
Exactly. So, as Pawan said, you need to have your business objective defined. So if your business objective is defined, that this is what I want to do. I want to, increase the market share. So, so that's one purpose. Second is I am already a leader. So I want to increase the market in itself, right? Because I'm already say 100 crore brand, I'm a market leader. So either I can look at prescription going to the competition, which might be difficult, but if I build the market, which is currently 150 crores, I am only 100 to a 300 crore, then what I'm doing is I'm increasing myself into a much bigger pie per se. So that's the other bit. So depending on what your brand strategy is, then you can define what the PR campaign will be.
In fact, to the level, I'll explain the way the pharma understands. Suppose a molecule, XYZ molecule, like Aman said, it is 100 crore, and now the tendency is now we are mature, we are the leaders, now nothing can be done. Now, take a step back. For you, this XYZ might be the competition, but for doctors, your competition is not their competition. They might be having some indirect molecules and all. Now scale that indirect competition in a graph. See where it has got a bump. If it is a seasonal or non-seasonal or a chronic therapy, you will find some insight that they were the indirect or a direct molecule is operating just by sales numbers or prescription trend of last 5 years, 10 years. You can collate and understand somewhere there is a bump and what is the reason because of that. Can we imbibe that here so that your product life cycle keeps on, the growth stage keeps on extending. So this is what numbers also matter.
Yeah, thank you, Aman and Pawan, for answering this. There are a lot of questions. I think we will have to hold more sessions on this particular topic and do the media training also, Aman, requesting your organization to take lead here.
Definitely.
Let us open the forum because a lot of questions are coming in. I have questions from my side also, but I will not be able to take. We'll park it for the next session. Opening the forum, please raise your hand and ask a question, interact with the speakers, and please be concise. My request is, though you may want to get into a debate format because it's a session on media and PR, but please refrain from doing that. Yeah, Nivedita, kindly unmute and ask a question.
Very good morning, and this is a great presentation, and thanks for that. So most of the brands are not in top 3, and then how to leverage this PR to the fullest or to get the advantage if I'm not in, forget about the leader, but not even in the top 3, I'm in the maybe top 10 brand.
Should I? So, Pawan, go ahead. Best person you go ahead and I'll chime in after that.
No, go ahead.
So I think Nivedita, okay, say for example, and I think you clearly defined that you're not in the top 3 and therefore you are one which is say in the top 10 per se. So I think the first step is to define that where do I want to be, right? Do I want to be in the top 3? That might be your natural extension to say I want to be in the top 3. Now for that particular, it's a journey which needs to be taken, say from a 9 to an 8 to a 7 to a 6. So the way the PR would work here is therefore we want to look at doing a much stronger doctor engagement, because the idea would be to work with a select set of doctors in a particular geography so that we can get the doctors to become our champions, and we use the doctors as my messengers to talk about a particular subject per se, right, which is related to my molecules. It could be, as Pawan said, it could be about, if it's a cough syrup, it's a cough syrup. So I will get doctors to talk about cough and why cough should not be ignored. right? Because people usually ignore, and why you need to go and talk to a doctor if it's a cough, because it could be anything, right? So what you're doing is you're getting people educated, but more than that, you're building engagement with the doctors outside of what you're doing in the traditional channels. And that outside of the digital engagement builds a stronger loyalty. It increases the footfalls of the patients, and it starts to therefore build more market share for your brand first. And as you will progress on that side, you will realize that your movement from being in the top 10 starts to move towards being in the top 3. And as you will progress, the geography increases. The type of tools or the channels which you use, you may initially start just by media, but then you add a more of a social and a digital ecosystem part of it. So that's the kind of a thing which is possible, not something which will happen overnight, but we have seen where you can do something like this over a period of time aligned with your own marketing strategy.
Yeah, Nivedita, very interesting question. You said it is not in top 3. My simple this thing, not as a PR or a digital this thing. Now, my first is, if it is not in top 3, what might be the priorities? You might want to build a critical mass or critical prescribers, set of prescribers. So the focus is there. So in there, you can use CorpCom to motivate your team people, like what he said, from 9th rank to 6th rank to, you're setting up an objective for internal. So instead of going directly with the PR, where many times it may not be required, you can have an internal communication. And secondly, trust me, there is no democracy in PR. Whatever you feel good, you do it and you are right. So how you do it, at what time you do it, is it aligning with your strategy? That is what it matters.
You are muted, Nivedita. You want to say something? Please unmute. Satish, can you? Yeah.
Thanks. I got it. But there are certain theories, the way you said anti-psoriasis, or we have launched osteoporotic molecule. There, the not much PR or the awareness is created by the top leaders, and therefore there are some areas where we feel their PR is necessary, and that's what the answer. That's what the question is, because we need pull. We need patient to reach out to doctors. That's the urgency. And at that time, I think PR or not to PR is a question, even for if we are a 6th or 7th launch brand, or maybe not in top 5. That's what. But your answer is right. Thanks.
So if the leader is not doing, that's a huge opportunity for the rest of the people, because I think Pawan said sometimes you become a leader and say, okay, done with.
It definitely, awareness can be your PR, madam.
Yeah.
Awareness can be a PR. You select this thing, say, suppose you told you launched after 5th or 6th. You might be the 50th brand. I don't care. But what are you doing to reach out to 50,000 doctors at one go? So, there are two things. If you have a bell curve graph, you have maximum number of doctors giving maximum, amount of business, right? There are some therapies wherein very doctors giving maximum number of business. So that strategic matter differs. Who is your target audience?
Thank you, Pawan and Aman, for giving the strategy right away. Next question over to Mr. Mohan, please, sir, interact.
Yeah, thanks. God bless you. It is both to Aman and Pawan. The negative of PR is the idiot syndrome, or what is known as cyberchondria.
Yeah.
How can organizations actually do something in this area? That is number one. Then the number 2 question is, you talked about fear, anger, trust. Am I audible?
Yeah.
Okay. The fear, anger, and trust. What is happening internationally also is that pharma industry per se is not respected the way it should be respected. Yeah. So, it's seen more as profiteering and manipulative, if you, get the drift of what I'm saying. What can one do in PR to take care of this? Is there some regulatory mechanism where we have ad boards, or take, for instance, clinical trials? Yeah, you have ethics committee. is there something that can be done to improve the pharma industry's image based on using these kinds of platforms?
So I think I can start from the second question which you asked in terms of the trust of the pharma industry, which I completely agree with you. If you look at the report which happened, the global report which came out before COVID, the pharma industry was at the lowest level of trust barometer, just above the tobacco industry, actually, which is something to be said. However, if you look at during the COVID time, the pharma industry's trust factor moved up a lot. And I think it was almost on in the top space per se. So I think we need to look at what happened during COVID time, that the trust of the industry went up. That was the time when the industry was out in the open talking about what they're doing. They were able to tell the problem which the people are facing and how as an industry they are coming together to make a difference in the lives of the people. And I think that is a kind of a need which has to be done, not just because there was a crisis out there. It has to be done on a consistent basis. And as Pawan said, crisis is always an opportunity. So I think industry at that time used it as an opportunity to showcase the value which they have. I think we as an industry do not do enough to showcase our relevance, our how we are able to solve a certain problems. Okay? And I think that needs to come in. The number of people whose lives are getting saved, how we able to improve the quality of the life of so many people. That data doesn't exist. If the data doesn't exist out there, then I won't really know who is helping. When you go and say who helped you, people will say hospitals, doctors, but nobody really knows that finally they are empowered by the pharma industry, not just from the molecule or the brand, but also from education. They are the one who will go out and tell them what's latest happening. And I think that storytelling is not happening. So we did work with IPA a couple of years back to do a campaign around, how the Indian pharma industry, and this is during COVID time, really came out to help the people. And I think that was a huge thing. And I think that needs to be done. It's an opportunity. It will help everyone. So Mohan sir, completely with you. It is a challenge, but I think this is where the PR could be the biggest tool to bring in an impact. Pawan, you may want to add.
It can be a game changer, sir. Mohan sir, PR is, I feel it is a double-edged sword. Every time you pick up this sword, it will be double-edged. And wherever there is a positive, it will always have a negative. And more important, human behavior can't be controlled. So the consistent, that is why PR is not one-time or two-time affair. It is a consistent affair at a particular interval to stay relevant. Now, having said that, how we behave typically, sir, we want to buy our shoes from a spick and span showroom from a 5,000 rupees, shoes. But when we pick up our onion and potatoes from a vendor who is sitting above the gutter, so something which we are putting in our foot on as shoes is 5,000 rupees in a premium showroom, in a AC showroom, but what we are taking inside. But the same people have problem when 10% increase is there in the price of a drug, which is a mandatory price. So you can't have there is no firm answer, but yes, consistent narrative can improvise, whether including the industry. As said, it is negatively taken.
Yeah, well said, both of you. Thanks. And what you're saying is right, but since we have a lot of questions in this area, when, how, frequently, what, about PR, right? That's why I thought I'll bring it to the table. And about the first question about the idiot syndrome or cyberchondria.
Sorry, sir?
The idiot syndrome is something that the doctors are becoming more and more cheesed off about because of so much information overload and availability. So internet derived information obstruction treatment, that is the idiot syndrome, right?
Absolutely.
What can we do as pharma companies to help the doctors or help the patients?
Sir,
You were
ideally,
talking about source
I
credibility.
feel this is more of a digital headache rather than the PR headache.
No,
Content, So digitally, whatever filter, how we, this idiot syndrome was there in pharma also when everything got locked down. All things moved from physical to WhatsApp, and everything became CMEs. And there was a tsunami of CMEs happening, tsunamis of message every day morning. So this is also part, we are at also, we have created that demon so big that we are not able to control that. So, but somewhere we have to, yes, give a good content, because internet is something which any content can be believed. And what is the authentication? And there is something called as which doctors know. They doctors have a limited space. If they have to have certain information, they'll go to Medscape or a particular website or a WebMD or this thing. These are the things which they believe. So if we make our presence in these kind of platforms, which are only doctor specific, that can help a lot.
Also, just to add what Pawan said, Mohan said, I think it's a simple part, and either you tell your own story or somebody else will, right? And I think that's what happens in a digital. That as a industry, people would believe in what we tell because we have the science, we have the facts, but we don't tell. There is somebody else doing our storytelling, and as Pawan was talking about during the time, that you open a YouTube and you put in a molecule, you will find somebody who doesn't even have the requisite qualification to speaking on something. So I think this is where, again, it's not just an opportunity, it's just a responsibility of the marketeers to say, am I putting in, and I do need to put in the information on the ecosystem. And when I say ecosystem, I always talk about an omni-channel strategy. It cannot be on one silo, where the information is available coming from the source, which in this case is company and the doctors, which has to be trusted by the people. And that will have a huge impact on people having an informed information. So we do need to ensure the patients or the caregivers are informed and educated. So when they talk to the doctors, they're having more meaningful conversation, and that is required, per se. And that, coupled with everything else which you were saying, would help really, up the way the world gets healthier. It will also help to the point to which it is, making industry a more trustworthy ecosystem. So it is an ask. It's a trust is at the core of this whole thing.
In fact, the brilliant example I can recall is before COVID. I don't know how many of even doctors or forget, maybe doctors, yes, but how many of general public knew what was ICMR?
Yeah,
before COVID. Now today ICMR, if they say something, it becomes a headline.
Yeah,
so that is how they got the PR. So if there is nothing, can we create a advocacy center? So that can also be a aspect in PR.
Brilliant. Thanks a lot. I mean, you've done such a good job in terms of preparing the presentation and the presentation itself. Thanks.
Thank
Because
you,
of this only we can ask questions. Thanks a lot.
thank you, sir.
Thank you, sir.
Thank you, Mohan sir. Thank you, Pawan and Aman. And just looking at this discussion that happened just now between the three, in healthcare, the ecosystem which is evolving with now digital platforms, digital solutions, physical platforms, and all those things, I think this training has to be done, Aman and Pawan. One more thing, when Mr. Mohan pointed out, we will take up a session on paid content, owned media, paid media, because I think there also we need to build trust, that how this content thing shapes up. So we'll bring in that part. Thank you, Mr. Mohan, for asking. Over to you, Mr. Akash.
Good afternoon, all. My question, of course, is related to
Akash, your
voice is breaking.
Okay, fair. I mean to say, my question is to, of course, Mr. Pawan and Aman as well. This is related to Mohan sir as well. Is it clear? Yeah. Okay. So the question is, we are into a traditional pharma promoting for so many years. But now, once PR involving, of course, it's a globalization having with, with the media. Few brands or few molecules are in OTC as well. So, promoting our brand with PR, there would be competitors as well who would be, saying, is it an ethical promotion or not? So this was, that is the reason I said it's related to Mohan sir as well. How to handle this? ekla chalo re wala path karna hai, ya we'll get bogged down with the competitors, going to doctors and saying this is not the ethical way, or they are cheap or something of that sort. I hope Mr. Pawan and Aman, you have got my question.
Yeah. Let me take this, Aman, very quick thoughts. First, there are 3 points which I can tell you, Akashji. First and foremost, PR is not what do you call a tool or this thing. PR is a process, right? PR is not like digital or this thing. You're moving your physical stuff into digital digitization. PR is a process wherein you have an opportunity to reach out, scale up, build new narratives, which your own medical reps are being only in the traditional format, which you told, medical rep and doctor and company movement, you can't do. Second, in terms when you say you are promoting your brand into social media or anything, no. I always told, don't, as a brand manager, please don't think of promoting brands in social media. It is not the way. You can't do that. Had that been the case, it would have been bombarded with so many things. It is the therapy which needs to be done. Now look at the scale of the opportunity which you have. You have hypertensives, you have diabetes, you have neuropsychiatry. How many talk about mental health? There's so much of things going on mental health, and what the campaign is running, give a hand to somebody who's having issues. The number of people who are not talking about mental health or coming out of and expressing their mental health problem. Now imagine somebody who's there in a neuropsychiatry this thing, they have a setup or some kind of a campaign they run, which is not a brand promotion but the purpose driven, which our doctors will also join the movement. So that can be, I remember Surf Excel, one of the very earlier, I don't want to give a particularly pharma example, so I'm taking a Surf Excel example. Many years back, you might have noticed they had come with a washing powder which doesn't cause lather, right? Jhaag nahi aata tha usme. But the challenge was, the big challenge in India was, till the time there is no lather, there is no cleaning. And that is why hand washes took so much time until even COVID nahi aaya hota, to hand wash bhi popular nahi hote. Because we have, Indians have a habit that till the time lather is not there, there is no cleaning. So that was a challenge. So what they started doing, with less lather, they started a narrative that it saves water. So what they started, save water movement. So they went 10 steps back. They started a campaign and the narratives in the media that how much water wastage is there and how Rajasthan, this thing, government involvement, everything, and so many campaigns. You can see that campaign, Surf Excel. And you will remember what brand I'm talking, and you will see the TV ad which had all women carrying 2 buckets of water, because that was a narrative that within just 2 buckets of water you can wash all the clothes. So this is how we need to think even in pharma, especially like I gave an example of mental health day, or neuropsychiatry companies can think of, the brand managers can do these kind of activities. So this is my take on that.
Yeah, thank you, Mr. Pawan. I got it. Yeah, thanks for answering.
Thank you, Akash, for asking. Dr. Amit, if you can ask a question, sir.
Hi, good afternoon, everyone. Good afternoon,
Hi,
Pawan.
sir.
Good afternoon, Pawan. Very nice to see you after a long time. Okay, just a couple of points, and one of the points which Mr. Mohan also raised. See, the issue is not about profit hearing. All said and done, pharma is a business and it needs to make profit. There is nothing to be ashamed about if we have expensive brands and we make profit. And the whole world understands that. The only reason why fingers are pointed at us is because some of us have lost credibility. Now, why have we lost credibility is very simple, either due to misinformation or disinformation. We just hide it. And that is the reason why even the big pharma like Pfizer is facing a lot of flack these days. So all that we need to do is we need to be correct, and we need to take it to all our customers, both the patients and the doctors. Doctors are very simple. We have established channels, our medical rep colleagues are there. They do it all and do it fantastically. So doctors are fine. It's the public. And for public, we need the PR and the media at different time points, as Pawan and Aman said. For different objectives, you need them. Now, another thing that is not happening, and which I hope somebody starts picking up, we did it in Lupin for a short while, but didn't take on. See, there is a lot happening in the R&D and in the manufacturing of pharma companies, which not a single product manager that I've seen in my 30 years has ever bothered to try to tap and take it to the market as a differentiator. All that is required is a short monthly meeting or 2 meetings in a month or something, 1 hour. It doesn't take up too much time. Just understand their process, because they don't know what is marketing. R&D doesn't know what is marketing. Manufacturing doesn't understand marketing. For them, हम ऐसे बना रहे हैं तो ये तो होता ही है. So what's great about it? But when a marketing person looks at it, he will realize, oh, this is something that I can blow up. You know, like what Kelvinator or whoever did, that puff thing. I mean, all of them have puff technology, but those guys blew it up. No? So similarly, I'm not saying that we blow up something which doesn't need to be blown up, but there are a lot of things happening in R&D and things which can be put not only in our visual aids and regular promotional material, but also marketed through the media. Absolutely. That our brand, we manufacture it like this, and this is a single, we are the only people who are doing this, we are the only people who are deploying this reagent or whatever. And let people know that, okay, if this is, and what is the implication of that? You know, you've got to link it clinically also. There's no point saying that, oh, we are doing this. So what? How does it help the quality? So that entire chain has to be explained in a very simple, 2-liner, 3-liner, and take it. So media and PR is where this will help a lot to take it to the general public at large, so that they know that company XYZ, oh, wow, let's take that brand. They will themselves go and buy that brand. The doctors don't even come in the picture. Because, I mean, you know how pharma buying happens in India. Everything is OTC for all practical purposes except opioid. So, so please do keep this in mind, that media and PR are very important in the grand scheme of marketing products. And credibility, building a credibility is only possible with good, short, concise content, which is to be repeated. You can't just do it as a campaign. चलो 1 quarter के लिए campaign कर लिया, 3 quarter के लिए campaign कर लिया. This has to be repeated again and again. Only repetition drills it into the mind of the doctor and the patients and the public. So please keep this in mind whenever you're planning anything. I'm sure it will help.
I have a slightly, without, don't get offended, but a little sarcastic response. I completely agree with Amit sir. Because, many of us, initially I did that mistake as well. We don't go to the plant and understand what is happening and all. And that even just by a process of, understanding the process of manufacturing, there can be great stories that can be brought up. I remember one of the beer brand, a long time back, Budweiser, if I remember this thing, they had a narrative told us, we sterilize our bottles.
Okay.
Right? All beer companies sterilize their bottles. But they were the first to tell that. Sales 30% up. So, yes, but a brand manager should go to the plant, understand what is the process, everything. But what happens?
Just an addendum to that. Addendum to that. Now, after this 30% rise, the other beer people will also say, oh, we are also sterilizing.
They can't do anything.
So then the story is told. I will take the line that because we started sterilizing, now others are sterilizing.
Absolutely.
So you can always remain one up.
But in fact, my sarcastic note was because brand managers come on board and the first thing they do is they change the logo. They want to announce their arrival. They want to announce their the predecessors had wrong strategy. So they are busy for 6 months, 7 months into that. So sorry about that, because I have been also the part of that. So
it's just that all this brainstorming is something that we all need to take in a positive way. Okay, thanks.
Thank you, Dr. Amit, for putting in the relevant point and Yes, I remember one book which we use in our training sessions also, Obvious Adams, and that is why Dr. Amit actually pointed out that in Obvious Adam book, you will read out examples where how sharply marketing could be done and very easy to do it. But yes, PR and media strategy should be a part of your plans also. Mr. Sachin, we will be taking this last question with our speakers, and let us do it here. Yes.
Yeah, first of all, I congratulate you for this wonderful seminar and amazing presentation by Mr. Pawan in terms of especially for all brand managers, like the PR role in, that's excellently good, Mr. Pawan. Like, because I'm sure a lot of brand managers would be here who will understand what is PR, because like, the way you conceptually made them, what is PR, and in pharma, how is the role? So one thing you have told time and again that you work on the problem, right? You work on the disease, right? You work on the major cause, right? And don't do the brand PR. That's perfectly fine and that's true. But I think a lot of pharma brand managers are not able to connect how to take it to their brand. For example, what I'm saying, somebody has a drug, say suppose in a PCOS, right, which is such a major problem, right? So doing that PR, what is towards the patient, around patients, around doctors, what is PCOS, what are the issues with the PCOS, building that. So most of them feel like, either this PR will help only the brand leader, doing that. So how he will be benefited? So he's not able to connect. And even that brand, so they have a fear. So if I'll put my lot of money budget into that exercise, how it's going to benefit me? So I think, Pawan, your next task may be like, when you're doing one seminar, to connect these dots and saying that how you take advantage of this by putting your brand in between. So your views on this, Pawan?
I'll try connect this right now. One of the very big PR gurus, he told me, a story that once a king wanted to demean Brahman or somebody. He told, तुम्हारे पास सिर्फ एक फूटी कौड़ी है, इससे कुछ ऐसा कुछ लेके आओ जो मेरा पूरा महल भर जाए, मतलब सभा पूरा भर जाए. People started laughing. What with that one coin he will go and get that he can fill the whole sabha and all. So the pujari or whatever he told, I'll come in the evening. He told, okay, come in the evening. The evening he came empty-handed, and then he came this thing. Everybody started laughing. एक फूटी कौड़ी लेके गए थे, पूरा महल भरने के लिए क्या लेके आया? Then he sat down and lit a candle in the evening. The whole room was full of light. So he filled everything with the light, and that is what PR can do if you think in a right way. Right? Many of the times we think that if we are doing benefit, unko milega. That means we are doing in a wrong way. We are not doing in a targeted way. If we know our critical mass, I want to target only Karnataka, I want to target only Maharashtra doctors, then there is possibility in PR. If we want to target only gynecologists, only physicians, or only orthopedicians, we can do that. So there are possibilities. So somewhere, many of the times, yes, rightly said, yes, there are limitations, but a little push on ourselves, I feel, can give us this thing. Or maybe our thinking is wrong, or maybe our direction is wrong, change the direction, but solution is always there. That's my take on that.
And Sachin, just to add to what Pawan said, there are two parts. One is not to do anything and let the market leader remain a leader, right? And as we know, that usually at a leadership position, people are not doing anything. So here, this is where the competition comes in. And it definitely helps gain more market share for the one who is sort of competing against the market leader, that I can assure you. It will benefit the market leader also. It's not, but it will benefit the one who is challenger to a much larger extent. Also, it will shape the market in a way you would like it to be shaped, right? So that's the other bit. How do you want to shape that particular market to your own benefit? Because then what you're saying is you're trying to really change the narrative itself. We need to, when we start thinking of a campaign like this, we look at what competition is saying, how are they positioned in the market, and how can I position myself differently, right? And that is where it comes in, because it's the same thing. Whenever we are going into the clinic also, we have, there are multiple branded generics. We're trying to showcase something different to compete against the competition. That narrative to be packaged in a way which could be going into an external world is where the brand and the PR agencies, but it has to be a specialist for which I'll continue to repeat. You need to understand the nuances of the pharma industry. You can't just look at pharma industry PR similar to what FMCG is done. You need to understand the medical side of it and all, the science behind it. And then, yes, you can go ahead and make it happen. And I can tell you, we have done with enough challenges, and that's when the competition starts to, start to wake up to say, "Ab hame kuch karna padega." But if you have a first mover advantage, you will have a first mover advantage.
Yeah, the last, sorry, Swati, just last 1 minute, and I'll not take much of time. So, yes, like, in pharma, when we say, like, prescription brands, there are a lot of limitations. But now the way a lot of nutraceuticals are coming, nutraceutical market has been growing up very vast, right? So I think their role of PR may have a different role to play and can be much beneficial, much better, because this is like, this comes out of from the prescription mode, and like, it can be promoted even from the brand perspective also as well.
Definitely.
So my sincere request to you guys, like, if in coming time on nutraceutical way also, if you can roll off PR connecting to the nutraceutical category, maybe a good version, because this market has been growing by leaps and bounds, and this has a major role. So that's the only one point I wanted to say. Thank you so much.
Definitely.
Absolutely.
It was a great time, like, wonderful.
There is a good saying that if you are ill, take a pill, and if you are not ill, take more pills. So that is where pharma, nutraceutical is 10 times, more than 10 times bigger than the treatment. Yeah, we can do that, a lot of it.
So thank you, Mr. Sachin, for giving us the topic for a few of our next sessions. Thank you for interacting and making out the relevant points for this particular session. Yes, as we always do, next time I'm going to keep the time at 2 hours, because it happens every time. And we want to try to contain it within the time limit, but the interactions are such, the queries are such that it spills over. Thank you for joining in. Thank you for putting up the right questions. And thank you for all of you, all the participants and speakers for making this session a success. And I would say a first mover session for the industry, because I don't think that there was such a knowledge session happening before for pharma marketeers on the topic of role of PR and media in pharma. So that's it from my side. Pawan and Aman, just in a few sentences, if you can.
First of all, thanks to Satish, who is back-end managing everything, back-end managing 3 people. Thanks to Swati having me. Aman, it was great interacting. And hope to meet you, because this is the first time we are interacting on this platform. It was great, interesting, and even through the questions, I could understand what are the next things industry might be looking for, to understand or try to understand. Thank you.
Thank you, Pawan. And thanks, Swati and Satish, for having us here. I think it's this was something which was much needed. Really, I think I just looked at the kind of questions coming in, and I think there is so much for us to all to do together, because as a pharma marketer where my journey started, I think there is so much for us to do. And I think we can really, bring in a paradigm shift in the way pharma marketing is done in India, and it can really benefit everyone, because there's a huge opportunity out there. We're not tapped into it enough, right? So if we just look at the population of 1.4 billion, the number of people who need our products, our innovations is huge. So it's for the larger good of the public is what we always believe we are sort of doing. So I think there is a need, and we do look forward to sort of working, Swati, along with you and Satish. I think there are a couple of topics which have already come out. So, from an SPAG Fin side, as a specialist, pharma PR firm, we are more than happy to work along with you guys. And Pawan, really, excited to sort of partner with you in this. I think there is a lot for us to, engage on. So definitely next time I am in town, and you and I should be catching up in person.
Sure.
And thank you both of you for not making it a debate sort of session like we were expecting. But yeah, Pawan, you were in that mood, and your attire looked like you are going to raise your hands like this and do something like that. But thank you for not doing it. And yes, Aman, and thanking the team from SPAG Fin, partners also, Shivani, Dheeraj, Divya, and Aman for joining us in this session and giving the knowledge to our audience. Looking forward to more sessions and more knowledge sharing. Thank you, participants, for sparing your time and joining us always.
Thank you all for wasting
all.
your Sunday with us.
It was a good investment, actually. Thank you so much, Pawan.
Thank you, guys.
Yeah.
Yeah.
So to participants, what you can do, we have posted the feedback link in the chat box, as we always do. To click the link and then you can move out of the meeting. We'll be closing the meeting within 30 seconds. So you can click at the link in the chat box. You can find the feedback form and then you can move out of the meeting. We'll just wait for 25 more seconds. After that, we'll end the meeting.
We request your feedback time and again for us to, and it helps us improve and bring in more insights. So kindly give us that feedback. Yeah, and I think we shall
Okay,
be
yeah.
closing.
So we are closing the session now. Have a lovely Sunday.
Wishing you a wonderful Sunday. Bye for now. Bye, Aman. Bye, Pawan.
Bye-bye.